This morning, we saw visuals of over 1,000 people in Vadodara, Gujarat, on the roads celebrating during a religious procession held by a local for his daughter at a nearby temple. Many, including BJP MLA Madhu Srivastav, who was seen dancing, were not wearing face masks. 57 named people and 800 to 1,000 unnamed people have been booked for seriously violating all COVID-19 rules and protocol, but the BJP MLA has not been booked yet. Gujarat has over 1,20,000 infections and Vadodara is the third worst hit district. And as of this morning, over 70% of ICUs and ventilators were occupied. Hi, my name is Pallavi Prasad and this is the curated newsworthy COVID-19 bulletin you've been looking for. India's COVID-19 tally has reached 56.43 lakh. The death toll has surged past 90,000 with over 1,100 fresh fatalities in the past 24 hours. Still the second worst hit, sandwiched between the US and Brazil in terms of worst hit nations. I want to highlight the situation in Maharashtra. Of India's nearly 2 lakh new cases this month, 46% of them have been recorded in Maharashtra alone. Mumbai was the initial epicenter, and so the state's efforts have been focused on the capital. But now the virus is spreading in rural areas, and the healthcare system there was never built to sustain a quickly spreading, possibly fatal virus. Rural areas account for over half of Maharashtra's total population. But till the second half of July, it accounted only for 16.5% of the state's total cases. With Unlock 4 well underway now, at 4.02 lakh cases, Maharashtra's rural regions make up for 34.4% of its numbers. Take Satara. Since September 1, Satara, a 20 square kilometer area, has recorded 16,000 new cases. It now has over 30,000 cases. But it has only 471 ICU beds and just above 1,100 oxygen beds, and the cases are only rising. And this is after 22 private hospitals have been converted to dedicated COVID-19 facilities. Officials on the ground are saying they did not expect the curve to rise so suddenly, that they were not prepared. A few days ago, I told you about how India is facing a medical oxygen shortage with cases rising and supply of oxygen not so much. Maharashtra has been especially hit in this regard, and now the government has stepped in. It has issued an order that oxygen consumption should be limited to 7 liters a minute for COVID patients in hospital wards. For patients in ICUs, this number should be 12 liters a minute. The state unit of the Indian Medical Association is calling this the biggest brutal attack on the lives of patients. A patient may need 2 to 10 liters of oxygen per minute. A patient in the ICU can need 10 to 30 liters a minute. For patients on ventilators, they could need as much as 30 to 90 liters a minute, and this is in non-COVID cases. So just imagine, the oxygen situation is so dire in the state that it has pushed the government to overrule doctors' discretion and knowledge about how to best save their patients. And the oxygen requirement, especially in rural areas of Maharashtra, are only set to increase by the end of the month. Globally, over 3.17 crore people have been infected till now, and over 975,000 people didn't make it. The US has surpassed 200,000 coronavirus deaths, accounting for around a fifth of all COVID deaths across the world. Its President Donald Trump said that if they hadn't done things right, 2 million people would have died instead. Then he went to the UN General Assembly and ranted against China for unleashing the virus onto the world. He also stands by his timeline that the country will have a vaccine by November. When asked if this was true, Dr. Fauci, America's top infectious expert, he said a simple no. Europe is seeing a sharp surge of cases again. Some countries like Albania, Bulgaria, Czech Republic are seeing higher number of cases than they did earlier in the year when they seemingly beat the virus. Belgium, Italy and the UK, among Europe's worst hit countries, are seeing a resurgence as well. But so far, nothing like March and April at least. Of the three, the UK's figures look the most worrying. France, Poland, the Netherlands, and Spain are also likely dealing with the much feared second wave and have begun reimposing restrictions and lockdowns. Vaccine wise, while the world struggles and races to get one decently effective and safe vaccine in place, Russia expects to register a second potential vaccine by October 15th. The vaccine has been developed by Siberia's Vector Institute, which completed early stage human trials of the vaccine only last week. So it's taking the Sputnik 5 route again. But so confident it is in Sputnik 5 that the Russian government has offered to shoulder some of the legal liability should anything go wrong with the vaccine, rather than requiring buyers to take on the full risk. Nothing quite like Russian confidence. India trials for Sputnik 5 could start in the next few weeks. Last stage trials for Oxford University's candidates have also begun this week in the country. Slowly but surely we'll get there. Till then, stay safe and wear a mask.